Yeah, we can do, for example. Right, and call this meeting to session at 6:08 p.m. Clerk, will you roll call please?
Director Burnworth,
Here.
Director Gupta,
Here.
Director Garcia,
Here.
Director Burker,
Here.
Director Van Dyke,
Here.
Director Ewan.
Here.
Would everybody please stand for the pledge of allegiance?
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
Now we'll move on to discussion. The exception to appoint a board member for an expired term of former director of Grove Properties and from November 2026 election cycle, subject to attestation.
So we had Mr. Ralph Cordova at the last board meeting. He was the only person who submitted a statement of interest. But then we heard just before last board meeting that former director Proctor was also interested in reappointment for his seat. He's here tonight. So that's a consideration. You have until March 10 to appoint someone. The next board meeting is March 12, as a reminder. So you can make the appointment tonight. And Brenda has both the blank and a prepared oath attestation and certification ready. So all you have to do is appoint.
A motion?
Make a motion to appoint former director Arturo Proctor to be the current director. I second.
No, I'm gonna second there. We can receive that. So.
I have a motion by Garcia and a second by Eric Lynn. We have to do roll call vote for this.
No.
All in favor, say aye.
Aye.
Any opposed? Abstention, motion carries.
Congratulations, Mr. Proctor.
Thank you.
So I'm gonna ask you to go over to. Oh, perfect. Hi. Let me grab the attestation because I have it here, but. So you're just gonna say, yeah, and then start here. I figured, and then we get here. Stop for enter. Okay. So Mr. Proctor, can you please stand?
Yes.
Raise your right hand to be sworn in.
Okay, you ready?
Ready?
I state your name.
Arturo Proctor.
You solemnly swear
Solemnly swear
that I will support and defend the Constitution of the United States
that I will support and defend the Constitution of the United States
and the Constitution of the State of California against all enemies,
and the Constitution of the State of California against all enemies,
foreign and domestic,
foreign and domestic,
that I will bear true and faith
that I will bear truth and faith,
allegiance to the Constitution of the United States
allegiance to the Constitution of the United States
and the Constitution of the State of California,
and the Constitution of the State of California,
and I take this obligation freely
and I take this obligation freely
without any mental reservation
without any mental reservation
or purpose of evasion,
or purpose of evasion,
and that I will well and faithfully
and that I will well and faithfully
discharge the duties upon which I'm about
discharge the duties upon which I am about to enter.
Thank you. Welcome back.
Thank you.
Oh. Whoopsie. Yeah. That says something right down here. Yeah, it's gotta be.
I was a fine for you.
Why park really my desk, right here?
And then, he told me I was like. I don't reach it.
Okay. He's gonna print out and then we just need your signature on something and we need your signature and then we're good.
Yeah, they're not your kid. She totally looks like.
Yes, yeah, she gets really mad. Tell her to. So now we'll go into close?
Yeah.
Okay, now we go into close. Okay. First.
Yeah.
I think everybody to get back first.
Is it welcome to come to?
Do I stay in or?
Yeah, you're in, that's why I was sorting in first. There, over.
Oh, no, you should have a real one. No, I can sit, no.
It's not terrible.
Yeah, I can sit in the front row. My computer is, not working, like, don't know. It's the craziest thing I've experienced. Okay. Please.
You have information in the cloud?
Yeah, I do, and I have to access it from my phone.
So it's pretty.
Yeah, go ahead, yeah.
Oh, the mic's sticking out now before it was blinking, the one on the top.
Yeah, it's on here.
Yeah.
It's just the screen, like something is, I think it's on, the screen is just not showing me anything.
Yeah, because it says it's on.
But it had nothing, the screen is like the level with yeah.
Right back.
It's gotta be something on even. That's okay. if we're not agreeing. It's the loan that's already signed, as they already have, but we're just agreeing to assume it effective as of closing. The same thing we did on PMH with Chapta, with the California Healthcare Financing Authority. To move it from PMH to Queens City. Pretty much taking that road.
All right, we'll go back into open session at 7:21 PM. So if this time we'll go to item 7. Consider approval of agenda in case of emergency items may be added to the agenda by an authority vote of the board of directors. An emergency is defined as a work stoppage, a crippling disaster, or other activity that severely imperils public health, safety, or both. Items on the agenda may be taken out of sequential order as their priorities determined by the board of directors. The board may take action on any item of the agenda. We have a motion to approve the calendar.
Second.
A motion by Goodsell and a second by Proctor. All in favor, say aye.
Aye.
Any opposed? Carries. Now we'll move back on to public comments. At this time, the board will hear comments on any agenda item. If any person wishes to be heard, they shall stand, address the board, identify themselves, and state the subject of a comment. Time limit for each speaker is 3 minutes per item to address the board. A total of 15 minutes will be allocated for each item for all members of the public. Does anybody have any comments?
Sure. I'd like to follow instructions.
Yeah, go for
Just
it.
say your name and.
Yeah, just, okay, so hi, everybody, buenas noches, welcome to Calixto. My name is Daniela Flores, I'm one of the co-founders and executive director for Imperial Valley Equity and Justice. I just wanna, say hello. We are focusing a lot on the healthcare initiatives in the county and, have been staying involved for a couple of years, just at least to understand what was happening with the district. And so my colleague and I has been coming to these meetings, but we'd look forward to, reaching out to you all and just very much grateful for all of your time that you spent on the district. And again, if we can be of service, definitely feel free to reach out, and we'll also be reaching out and look forward to meeting with hopefully each and every one of you.
Do you have any other public comments? None. We have a board comments. We have a brief reports by directors on meetings and events attended. All right. Report by the merger strategic planning and marketing.
The ad hoc continues to meet, and we continue to have meetings with bondholder regarding bondholder consent, which is the only issue that is tying up the merger from happening currently. So we're going to continue to press the bondholder on what we need to do to get to close.
Finance committee, I think.
Yes, thank you. The finance committee met, February 23rd of this month. We reviewed the January financials and profit and loss statements. We also reviewed and approved, subject to legal approval, for recommendation to the board of directors, the following items. Action item 11B on today's agenda, for approval of the Baker Tilly audit in 2026. Action item 11C, Alliant Broker Services. Action item 11D, which dietary water services. And action item 11E, authorization to approve emergency medical care on call for Kala Damara MD.
Now move on to the consent calendar. 10, any member of the board may request that items for the consent calendar be removed for discussion. Items so removed shall be acted upon separately immediately following approval of items remaining on the consent calendar. Do you have a motion?
I just want to bring to the board's attention that items C and D of 11 would normally be on consent because finance committee approved them, but because of timing, we couldn't put them on consent without the finance committee having approved them first, which happened this past Monday, and the agenda went out last Friday. So that's just a timing thing that will resolve, but otherwise those would have been on consent. I'm just letting you know.
Does anybody want to move them to consent? Or would that be an adjustment?
What you could do is, last time you approved all items that the finance committee approved in one fell swoop, so maybe when you get to item 11B, you could consider B, C, D, and E in the slate, if you wanted to.
Perfect. So do you have a motion to approve the consent calendar?
I found.
I'll second.
I have a motion by Goodsell and a second by Garcia. All in favor, say aye.
Aye.
Any opposed? Any abstentions? Motion carries. Medical staff report recommendations from the medical exec committee for medical staff membership and or clinical privileges, policies, procedures, and other related recommendations.
It's Dr. Al Sharif online.
Hi, Dr.
Somebody
Al-Sharif, can you hear us? Okay,
Yes, I do. Yes, I do.
Go ahead.
Okay. Yeah, sorry, thank you. Okay, so the medical executive committee met in February 18, and the items of consideration for the medical board that the committee is recommending, the medical executive committee is recommending the approval of the following. There was a summary and background. The medical executive committee, upon the recommendation of the credential committee and the respective clinical services and or chiefs, and based on the complete medical files, policies and procedure, recommends that the medical staff membership and or clinical privileges to be granted as follow and as below. There was recommendation for initial appointment to the professional staff effective March 1st, 2026. And there was a recommendation for reappointment for staff members effective April 1, 2026. And there was a recommendation for acceptance of resignation for medical staff members effective February 28, 2026. And there was a recommendation for release from proctoring for some staff members effective April 1, 2026. There was a recommendation of release of proctoring and advancement for staff members effective April 1, 2026. And there was a recommendation for change or addition of privileges for some staff members. Also recommended acceptance of the policies and form presented. Also present on the meeting that the respiratory mask fit testing compliance is at 60%. Dr. Guan gave a presentation with regards to adding independent practice standards for the nurse practitioner on the medical staff. With the signing of legislation AB 890, these individuals can practice independently in both the clinic and the hospital settings. And she mentioned that we need to create a path for oversight of these practitioners with something the medical executive committee will work on. Also, Mr. Herrenberg stated that we continue to work toward the merge on March 6. And Mr. Velez reported that we are working with the bondholders for both facilities on the merge. The financial report was not presented, and it was presented that there was a total of 4,487 ER visits in a month of January with 118 transfer, which represents 2.62%. The Joint Commission is in the Centro for a credentialing survey, and the clinical services and committees were reported during the meetings. The recommendation is that the Imperial Valley Healthcare District Board of Directors approves each of the recommendation of the Medical Executive Committee for medical staff membership and the clinical privileges as outlined above, policies and procedure as noted, and authorize the Chief Executive Officer to sign any document to implement the same. Thank you.
Any questions? I just have one.
Yeah.
You look on item 12 on the report, Dr. Al-Sharif, where it talks about the ER visits. It says
Yes.
patient experience likelihood to recommend is at 66%. What's like the
So-
standard, or what are we doing to improve that number?
Yeah, thank you for, this is actually a very good question. We asked the same question for Carol. And so we did not have the standards, the conversation was that we are going to have a standards. So we know what's like the median, how we are improving as a hospital month to month, and also how to compare us to the other facilities. But this was a question actually that mentioned on the meeting, and Carol is working on getting basically the more information on what is this number stand for compared with other places, and how this number will change from month to month.
Thank you.
It's
Thank
part
you.
of my, annual report, so I can tell you more than you'd be like.
Thank you.
I just had a quick question. I have to ask this, or else it's gonna bother me. On the reappointment list of doctors, for doctors today, it says change to courtesy. What does that mean exactly?
So if I understand the courtesy correct, and Mr. Hernberg can also help me, the courtesy, they have privileges, but they don't have voting rights. They can admit and see patients, but they are not part of the voting committee. I understand it correct.
Thank you.
So they are active staff members. They can see patients, they can admit, they can do everything, but they don't vote.
Any other questions from the board? All right, do I have a motion to approve?
I move we approve. I second.
A motion by Eric Wayne and a second by Proctor. All in favor, say aye. Any opposed? Thank you. Motion carries. Thank you, Dr. Al Sharif.
Thank you, Dr.
Thank you.
Thank you.
We'll move on to, I believe we had a recommendation from the finance committee to approve items B, C, and D, so, and E. So unless anybody has any questions, I mean, there is also a policy and procedure on there as well. So
There's two of them. Yeah, H is also a policy, F and H.
unless anybody has questions, we can approve the slate, or we can,
Move we approve as a slate.
Are you talking about B through E? The finance committee one?
Finance committee ones.
Okay.
you have a second?
Second.
I have a motion by Eric Goyen and a second by Burker. All in favor, say aye.
Aye.
Any opposed? Any abstention? Carries.
Did the finance committee approve the policy, the on-call?
That wasn't on.
I didn't think so.
Yeah, Now move on to action item F, policy and procedure, standby on-call and callback pay. Anybody has any questions?
I had a question. On paragraph 8.3. There at the last sentence of that paragraph. So as I understood it, the on-call, if you call someone in, they got 2 hours automatically. But then if you call them back, they got paid for that hour. Moving forward, right? They came back and forth, they just got paid for that hour. And then so now they're asking to make a modification to where if they leave the hospital and they get called back again within their on-call time period, they get that 2 hours again. And then-
No, that's what's happening now. That's the change. The change is to make it so that, like, if I'm the person on call, for example, and I come in for 15 minutes, I still get paid for 2 hours because I'm on call. But if I leave and they call me again in a half hour to come back in, then I'm still in that 2 hour window. So I don't get another 2 hours, even though I'm an hour and 15 minutes into my call time. I'll come in for that half hour and it still counts in that 2 hours. It's not two different 2 hour intervals. And that's what's happening right now is the policy is that does state that way. And that's why the changes were made so that, because you can run into a situation if you do it that way, where somebody actually gets paid 26 hours for a 24-hour day, and that doesn't work. So. Yep. Yeah.
And I know that they had talked about, there are additional changes we need to make to this policy. But it was in the interest of the organization to bring it forward in its current form now, so that we're fixing things sort of surgically as we go along. But there's a good chance you might see this policy come back in the next month, once they've had an opportunity to work through, like, operationally, how does this actually work? And then how can we maybe flesh out a couple other things with more clarity? That's what I was.
I had a question. Are you going to actually have every position that's now on call read this and re-sign it, or do they have call contracts that they?
Yeah, anybody, like, we would send it out as an update.
Set up to?
Yep, so the review.
For employees.
For employees, it's employees. Yeah. Yeah,
That's what you're saying.
Does
That's employees, right?
it apply to like midwives?
those that are employed with us, yes. Yep.
Do you have any more questions? No, do we have a motion?
I so moved.
Also.
We have a motion by Berger and a second by Christina. All in favor, say aye.
Aye.
Any opposed? Abstention? Carried. Now we move on to item G. Staff recommends action to authorize resolution number 2026 -022226, resolution of the Imperial Valley Board of Directors assuming and accepting the rights, responsibilities, and obligations under the distressed hospital loan and security agreement presented by.
I'll do it. So this is administrative required for the merger. This basically says that we are agreeing to assume the obligations of ECRMC as ECRMC's successor by contract to their distressed hospital loan when the merger closes. So you'll note this is effective only as of the date of closing. So once we close, that means that the distressed hospital loan that's in ECRMC's name would transfer over. This is actually already established in the ATA, but CHAFA, the California Healthcare Facilities Financing Authority, requires a standalone resolution. And so you might remember this from, we had to do this same exercise, even though we had already taken over PMH. They asked us to do a resolution from PMHD to IBHD when IBHD took over PMH. So this is really like administrative check the box exercise, but they're gonna ask for it, so we might as well get it out of the way now. And I'm sorry, we didn't attach the actual distressed hospital loan and security agreement. It's not anything you're approving. It's the document that was already approved and entered into by ECRMC and CHAFA. And I'm happy to circulate that. It was just an oversight that it wasn't attached.
Make a motion to approve the resolution.
I have a motion by Garcia and a second by Jigsaw. All in favor, say aye.
Aye.
On to item H, staff recommend action authorized policy number HRD -00073, employee employer organization relations. Chris Bjornberg and Brian.
It might be part of the over, so that's my fault.
Yeah, it's just it's a policy. It's just like the other ones, like we're
My understanding that this is also like getting us to the merger, because I think it's about, and my understanding is it's about organizations, so like unions. So we need to have.
we changed it to district wide because before it was that wasn't included in the language in there. And so we included the language to include the entire district for this portion of it. And then also changed some of the other like nomenclature that was involved in there before with the PMHD and versus IBHD.
Yeah, and it's also, there are some changes made to incorporate what we expect to be, taking on the union folks when that merger happens.
They added,
Because we
yeah.
don't have that language in there right now because we don't have a union right now.
Yep.
So.
Have any questions? Or motion?
I move we approve policy number HRD 00073.
A second.
I have a motion by Gitzel and a second by Garcia. All in favor, say aye. Any opposed? Any abstentions? Carries. Now we'll move on to management reports, finance with Carly Wilbur. And I just want to point out, there's a couple of new, financials in here for you guys to review. And a couple items that I did speak with finance committee on today that aren't in here. One thing I want to point out is the federal government eliminated the dish tax for right now. So we'll have a pickup on that. So for this year, we have about 1.7 million we'll have 1.7 million revenue growth. And with those cuts being eliminated, that will go up to 3.7. So about another $2 million pickup between now and this fiscal year just for that supplemental payment program. I also wanted to do an update, which is more an update for the finance committee. So finally heard back from Meridian yesterday on our cost report. They actually did send a extension until March 12th for our IDHD cost report. So that superseded their previous letter that said that they would not accept our cost report and that they were going to withhold funds and that they were not withholding our funds from us. Although they are, and so they looked into it a little more and got back to me today and said it had to do with our PIP payment and something about a stop date was in there. They corrected it. There's no longer a stop date in there. And so I did say, okay, am I going to get a big lump sum for my PIP payments? But I haven't received anything since January, and then I get to hear back. So it was on them. They had some wrong data in their system. Our customer prayers are almost done, getting ready to splitting them, and they should be done tomorrow. We'll submit it back to them, and I'll continue working on getting our Medicare. Hopefully within the next couple weeks. At least I'm hoping the next week, so I don't hear from my weeks, but I don't see a lot of eventually. I thank you guys on that. The extra reports that I have in here, you'll see, our investments. So I wanted to put that in there because next month you're going to see a funds investment, and we do this is reviewed annually by our auditors, but per the policy, the board is supposed to see where all of our funds are being invested quarterly. So I wanted to give these details for you. And then also there's a cheat sheet on kind of the regulations that we have to follow. Example, we can't have more than 30% of our funding in corporate bond. It's a California government code that we have to follow. So that's what that other sheet is in there, just for information for you guys. You guys have any questions on the financial? Questions? Anything? I can move on to the hospital operations report.
I don't have one.
Okay. Now we'll move on to. CNO report.
Hi, everyone. Good. So you have the CNO report on hand. For transfers, there was 118 transfers for the month of January. That's a 2.62% as far as how many transfers from the ER visits are going out. Nothing new as far as the report that I submitted. If you look at, do you have questions about the transfer report? No? Okay.
I do.
Sure.
Why do we have, I guess pediatrics is like the highest one, why?
So for pediatrics, a lot of the transfers, when I review them, it's cases that need a lot of times higher level of care, or they're going in for something that maybe we can take care of, but they have other conditions that require specialty services that we just don't have. They might have like some kind of genetic disease or just something else that they really need to be going to children's for because they need that specialty service that we don't provide for children.
Thank you. I do have a question as well. Is that the same case for cardiology, gastroenterology, and neurosurgery?
So for those, it varies. A lot of the cardiac stuff, they're going for, if STEMIs, and they're going for intervention, and we don't provide that at our facility yet. So that's cardiac, GI, sometimes you don't have coverage, and so you're being transferred for that reason, or they also, it's GI, but they need higher level of care that the docs at the Pioneers don't feel comfortable taking care of. And what was the other one? The neuro, Those are usually like our stroke patients that require intervention, neurosurgery. Dr. Guan worked on a report for transfers that she's gonna share with the medical staff. I think the first place she's gonna go to is the surgery committee. And she's already looked at some areas where we have opportunity to keep those patients, so she'll be sharing that there. And then as that information is shared, it'll make its way back here.
So how many days do we have coverage for gastroenterology at the hospital present?
16 to 17 days.
17?
We have Mohammed Sullivan, Idris Sullivan, and Dr.
And you only get 16, 17 days out of it. And how many of those do we have a PSA?
Well, two. So, and both of them, actually, one of them actually does more call than what the content is.
Okay, so then on the second page, just gonna go over the patient experience that was brought up. We started adding the likely to recommend. This one here is important because it talks about loyalty to the organization as far as our patients, our customers, family members. It's how, often they're gonna come and receive services at our organization, and then they're gonna go to their family members and their friends and say, hey, go to Pioneers had great service, and then they keep returning. So that's really important. For January, we were at 66%. In the report, I did ask what our goals should be. So if we want to have like a 30% improvement, we would want to go up to 78.5% percentile rank. So compared with other organizations that are also part of PACBAMI, we're at 76. We haven't decided what our goals are going to be. It is part of the strategic plan for IBHD. But as we merge, we're already discussing what those goals need to be for both campuses.
90%.
That's what I said.
So that score goal right there, is just that small increment, but that's not going to be the set goal. Do you have questions about that? The patient experience metrics?
No, I love that you guys are.
I have two reports here that if you allow me to, I'll share with you because it's all green in terms of, so this here, it's just 3 items, right? But when you're looking at HCAHPS scores, there's also, I don't know, like over 15 questions that you could drill down to. And every month we look at those. And this month, except for one, they're all green because they're trending in a positive way. So we're really proud of that. And I'll share it. So one thing I wanted to share with you, because you might hear it when you're out in the community, we're really busy right now. The other day, our census was 90, we had 90 patients for our census. Someone commented, he's like, I haven't seen those numbers since COVID. And so I just wanted to share how proud I am of everyone working so well together to making sure we take care of our community and that we keep things safe in the emergency department. Because when we're holding that many patients in the emergency department, our true ER patients get displaced from there. And so it's really important that we not only take care of the ones that are holding for admissions to go to inpatient bed, but that we're also taking care of those emergency patients that might be coming in because of chest pain or because, they're bleeding or something else is going on. And they've done so well, everyone. And today when we were at department leaders meeting, it's not just like the nurses in med-surg or the nurses in the ER. It's everyone. When we're that busy, everyone is working harder. For example, nutrition mentioned today that they had to give out 22 food trays in the ER, which is something that they don't you have to do, EVS, the turnaround time for EVS to be able to clean those beds so that we can bring patients in was phenomenal. And, because they knew how important it was for us to be able to do that. Registration, having to register patients and change them from ER status to, inpatient status, that all takes work, lab services, radiology, and it's everyone working together. I wish I could find the picture. There's this picture from a long time ago, like, I don't know, like 50s or something like that. Maybe a little bit later. And it's one patient in a wheelchair, and behind the patient, there's like 20 people, like clinical people behind him. So that's how many people it takes to be able to take care of that patient. And so I always love that. And I wish we could do that. And then one of like, now, like it's still the one patient with the family, but it has 20, 30 people that are impacting their care. So I just wanted to share that and shout out to all the, not just the clinical staff, but also the ancillary departments who are working so well together. That's all. Here.
I have a question, but I would just like to say that, well, first, thank you, and thank you to everybody, but you remember that when we first started all of this, that we always said that the people on the front line are the most important people, right? Because it's if it's not for them, we can't do what we have to do. But it's also up to you guys to come up with ideas to push up to, the CEOs on how we can better things to provide that better service, because the ideas come from all of you.
Yeah, but it's their hard work.
Absolutely.
And
So
we
I
really
mean by them
Yeah.
bringing stuff up and
Yeah.
saying, hey, maybe we can make some improvements here and there and make it better. Thank you. Appreciate it.
No report from you. You should check, why are you even? I think so. Do we have an urgent care update?
Their patient, their volumes are staying steady. They're putting up 4 per day for the last month. They're continuing almost like the breaking over.
Executive update.
I just want to give you guys an update on something we had talked about previously. We are working with Dr. Tyson and his group to finalize bringing back that south side of the building. We asked them to get us a few things that we didn't get them in time to be able to bring that to you guys this time, but the hope is that we'll bring it to you next time to do the amendment to his current agreement, so we can start taking that spot over. With that, most of the stuff that we've been doing has been all around the merger and acquisition portion of everything. And, I think that the teams have worked together. I talked a little bit last time about some of the stuff that happened with Joint Commission and a meeting that we did there. And then furthermore, they did have Joint Commission at ECRMC. And I think that was another great opportunity and that was something they talked about today in our department meeting as well. Is the opportunity that the team from Pioneers had to go and be able to spend some of that time with the team there at ECRMC and see how that process worked and work together with them. And in some cases, especially like on the facilities side, they were able to really work hand in hand with them on a lot of those things. And all of those things are going to be beneficial to them. They brought that up too, because we're going to be going through the same process at Pioneers that we just went through at ECRMC. And now the team there has a little bit better experience about that. They got to see how it was done. They did a great job over there. The team at ECRMC did. And so they got to see how that process played out. And so there's a lot of things that are going really well from that standpoint that I just wanted to bring up and share with you guys as a board, and really to kind of echo what Carol had mentioned as well, because it has been good to see how that process worked. And on that day especially when it was heavy on Tuesday, going into the ER and talking with them, it was very interesting, because probably, same time last year, and even probably the year before that, it was chaos. And it's chaos now, but like Carol says, more like organized chaos. And that's what it was. Like you can see that with how the team reacts to it now because of because of the things that have been put in place to get us to this point. There are a lot of things that Carol and her team have done and others that affect that whole process that we put in place to be able to make that happen. So when these things happen, it was, I mean, if you walked through there, you wouldn't have really known that was what was happening, except for there's so many people everywhere. But the team didn't look like they were over, excited about anything. They were managing the process well. You went upstairs, the same thing was happening there. You went in the kitchen, the same thing was happening there. Everybody knew what to do and where to, how to do it. And so it was really good to see those things start to really come into place and to see, some of the things that we've been working on for a while to get to this point, like it kind of really played out in those moments. And so the team did a phenomenal job with that process, and to see that happen was like really nice to be able to see that, because sometimes it's more chaos than organized chaos, and this time it was organized chaos, and it was very, very busy. So I just wanted to pass that on. There wasn't much more else that I wanted to provide to you at this point, just because, like I said, everything has really been centered around the acquisition merger and all the processes there that we've talked about multiple times.
Thank you.
Thanks.
I think at this point, we're all burned out on the merger.
Yeah. We all just want it to be done. We want to be there, and we want to just we're over that part. And let us just we know what we need to do. Let us just do it.
So they have to, run hospitals, take care of patients and all that, and they're still dealing with this acquisition. So
It'll get done.
hats off to all of you guys. Paula, do you have any updates?
No, actually, I rounded on Tuesday because I was at training, Tuesday morning. And rounded in the emergency department with some of the docs. They were holding so many patients. So it was very, very, well organized. There was the sky is falling, the place was very clean. So I was very impressed with the care that the patients were providing. And the nurses up on the med surg area, they were, moving beds and trying to get beds to put patients. So there was great teamwork being done there. We just went through the Joint Commission. Some of the folks came down to observe. Because eventually we want everybody to be Joint Commission certified. And then the last thing this week, we got the deepest SNF license transferred to ESAMC. So we'll be managing the long-term care facility across the street. So once we do the merger, that would go into the district, and we would have the two distinct nursing homes down in the valley.
How many beds are in that one?
123, 21.
How many is pioneers?
99.
90.
What realistically, what is it, 1.7?
Yeah, I think our capacity right now is could potentially be 87 or something, 86.
It's always like.
But it's not
It's always like in the 60s, 70s, it seems like.
Yeah, we're up in the 70s now.
How many are in the 123 beds?
They're all.
They're all full. Oh.
Yeah.
Doing legal updates.
I was gonna also let you know, because I heard from regulatory counsel that CDPH had approved the addition of the SNF ECPAC beds to the ECRMC license, so that's awesome. And I want to remind the board about the April 1 filing deadline for your Form 700s, which you're supposed to do online. If you have questions about how to fill it out, call me or text me or email me. But don't forget, April 1 is your deadline. And with Returning Director Proctor, you're gonna have to file an assuming office Form 700 within 30 days of today.
Okay, now, I think I was supposed to do
The leaving office one.
okay, so I'll do them back to back.
Yeah.
Thank you.
You can, we'll talk about it.
I have missed one before.
We'll do it, President.
They do, no, I have paid my $150
For your,
or something that was free. So,
yeah,
You know?
I'm doing it as a guarantee mechanism, yeah.
My wife's allowance is only $40 a month, so I gotta see.
can't
Yeah.
complain. It's like a per day and then you hit a max, so.
And to the extent, I don't know if Letty or someone sends out reminders to the filers on your code. We're gonna bring back a, excuse me, amended conflict of interest code in March. Because we want to have it in place before April 1, but also we were planning on waiting until post-merger to have the new org chart approved so that the new org chart can list, so that the amended conflict of interest code can list the positions consistent with the new org chart, because there's gonna be new titles. But I think we're just gonna have to do it twice. Because it's been too long already. We assumed PMH's conflict of interest code when we assumed PMH back in January. But, we should have one in IVHD's name. And so the code will come, it's not gonna be different really from PMH's. And that's only about 5. So it's gonna be pretty administrative, ministerial.
Do any of the employees for PMH have to file 700s?
Yeah, many of them do. Folks like Chris, Carly, and folks in like positions to utilize or approve public money are generally the ones that have to file. So PMH's code is like department heads, DC, I think. So legal counsel, I have to file one. So. But yeah, you folks, we file with PMH or with IVHD, and you now, for the first time this year, file with the FPPC electronically online. So you should have gotten a link, you should have gotten a link sent to your email back in January or maybe December. So, but again, if you have questions, we have time, it's April 1, but I'm bringing it up now because inevitably I get a call like the week before, like, wait, what am I supposed to do? So just reminding you now.
The good thing online is they save your one device.
Yeah, it's great.
You just click,
Just click it.
you just click it.
Nothing's changed. Yeah, I haven't bought some new mansion across the street from the hospital yet. Yeah. That's the only report I have.
No. Do you have any items for future agenda you would like to add? Discuss? If not, I will adjourn this meeting at 8:03 PM until the next board meeting on March 12th at 6 PM, which will be on.
Thank you for joining us.
Impressive that I also